Urothelial bladder cancer is a cancer that arises from the urothelial cells, which are the inner lining of the bladder, collecting systems of the kidneys and the ureters, and they also line part of the urethra. Most commonly, this cancer occurs in the bladder, and other sites are much more rare, such as the upper tracts and the urethra. Human body excretes metabolites through urine, and some of these metabolites are toxic to the cells, and they can also give rise to cancers by promoting some mutations in the way cells divide and develop. We know some of these substances, or we call them carcinogens, but there are a lot more that we don't know. The reason these cancers can come back more frequently than in other types of cancers, because there are precancerous changes that take time to develop in these cells. So new cancers can show up over time, and sometimes also some continued exposure to these carcinogens can cause issues and create more cancers. There is a small percentage of patients who may have genetic predisposition to urothelial cancers, and obviously those are patients that may have these cancers pop up very frequently. The other thing that we need to think about, there's a lot of surface in the body that's lined up with these types of urothelial cells, and much like the cancers of the screen, when one area is affected by a certain kind of a carcinogen or anything that leads to cancer development, the rest of the surface is also susceptible to these changes. So there's a whole lot of urothelium that can kind of give rise to cancers, even if you treat the cancer in one area. So I think the biggest issue with the bladder cancer is just the ability for these cancers to recur, and that takes a huge toll on the patient's mental health. You know, there's this uncertainty of the risk of recurrence and progression. People have to come in every 3 months sometimes to have a checkup, and it just immense anxiety that builds up for every time before they come into the checkup. And we deal with this all the time with the patients. Some people handle it better, some people handle it worse, but it's just, we know that in a bladder cancer population, this toll is very huge. Well, women are used to seeing blood in urine. Okay, so blood in urine can be mistaken for urinary tract infections or gynecological causes. So women, when they see blood in the urine, by default, they can go to a pharmacy, get a antibiotic for the Minute Clinic. They can seek evaluation from a gynecologist. So as a result, they receive multiple courses of antibiotics, and on average, their diagnostic evaluation is delayed until the referral to urologist is made. It's not a very simple answer to this. I think there is a multifactorial nature of this finding. Number one, we touched on there's a delay in diagnosis. So women may have advanced stage at presentation. The other thing is the biology in men and women is a little bit different. Women have different microbiome in the bladder, which can either delay or prevent the rise of bladder cancer. And sometimes it can either augment or the vice versa, the progression of these cancers. The other thing is there are different hormonal composition in the human body, whether it's a man or woman, and that can affect the way the body metabolizes carcinogens, and also it can affect the way the cells progress in their cancer pathways. I think any cancer diagnosis, especially if the solution is not straightforward, should warrant a second opinion. The easiest way to go about finding a second opinion kind of person or institution is to look at reputable institutions for treating cancer. Sometimes people can search advocacy networks for the particular type of cancer, so the bladder cancer. There are support groups that patients participate in, and this can also be a source for patients. It's usually very easy to request a second opinion. Most of the time, all you need is the diagnosis of bladder cancer to be able to get in to see the specialist. Sometimes, some specialists may require referral from either a urologist or a primary care physician. One thing I would just emphasize is to make sure to have all the pertinent diagnostic workup that had happened prior to the second opinion consultation to help us provide the most accurate advice to the patient. We know there is a high proportion of patients with a diagnosis of bladder cancer, and even new diagnosis of bladder cancer, who experience mood disorders such as depression and anxiety. That number is fairly high. Having a mood disorder can affect the ability to cope with the disease itself on both the emotional and biological level. On the emotional level, people who are depressed may not have the motivation and the ability to kind of go through the great lengths of having the treatment as they need to. And on the biological level, there are a lot of circulating kind of cytokines and hormones that can be either suppressed or activated by the mechanisms that cause the mood disorders, and they can also affect the progression and the outcome of the disease. One thing I want to bring up is it's very important for the patient to seek an opinion from a mental health professional when these kinds of things happening. It's important to know that you're not alone in this battle, and important to know that clinicians are aware that these kinds of things are happening to the patient. So there's always willingness and ability to put people in touch with the appropriate specialist to have a multidisciplinary battle against this cancer. It's important to know that there are advocacy networks that are reputable sources for getting answers to the questions. And, I feel like this is like the golden era of bladder cancer, because when I first started practicing, there was very little, treatments and information about bladder cancer. And now, it's just flourishing. We have all these new treatments, more treatments are coming down the line, and there's a lot more awareness for women in bladder cancer. I think, a few years from now, we're going to have a lot more answers to the questions that we're trying to answer.